Good morning. Thank you for being here, and welcome to the 10th Annual National Summit on Health Disparities. We look forward to all of the great dialogue, discussion, and information that's going to be shared today and tomorrow when we do the 2013 Spring Health Braintrust. I really want to, at the very outset, give a very special and deeply sincere thank you to Dr. Gary Puckrein, to Gretchen Wortman, and Jeff Berry with the National Minority Equality Forum. We've been extremely fortunate to be partnering with them for the last several years. Thankful to them for the great working relationship that we have, but also the great friendship that we have. And it's not just once or twice a year that we get together to talk and to work on health equity. This is an ongoing relationship, an ongoing working relationship for all of us, whether it's been dealing with making sure that end-stage renal disease patients got their medication, looking at new and different combinations of medicines that would help African Americans and other people of color, or many, many issues. So we really value and are grateful for the relationship that we've had over the years. I want to also say a special welcome to Dr. Jeremy Lazarus, President of the American Medical Association, Dr. Cedric Bright, who is standing in, past president, but standing in for our current president of the National Medical Association, Rahn Bailey, and Dr. Akinboboye, president of, I got it right? Yes. He's been in the Virgin Islands, so I had a chance to practice this. Yeah, president of the Association of Black Cardiologists. And I also want to recognize and thank Eli Lilly, Pfizer, and especially Joyce Larkin and the Centene Corporation for their partnership and for their strong support of our collective efforts to achieve health equity and eliminate health disparities. And certainly not least, I want to thank the many outstanding panelists that will be joining us these 2 days, as well as all of you who have come from all across the country to share your expertise, lessons learned, concerns, and successes with us in what will be a very, very informative and I hope transformative conference. This year's conference couldn't have come at a better time because we're at such a crossroads with our reforming and hopefully transforming our healthcare system. We've already seen some wonderful provisions in the Affordable Care Act come to fruition, and starting in October and then in January of 2014, we'll see the impact of the access expansion provisions when the health insurance exchanges get up and running and when Medicaid is expanded in the states that plan to expand this critically important program. But I think that as that expansion gets started, if all of us do what we need to do, we'll see the other states that have not yet joining in. But we're at a crossroads for other reasons too. I know that I'm here with some of the nation's experts and strongest health equity advocates, and so I know that I'm in good company when I say that health equity is so much more than just having an insurance card. So don't misunderstand. I know that access and that insurance is very, very important. And we fought very hard to achieve that for as many people as we could in the Affordable Care Act. But addressing the social, environmental, political, and other determinants of health, as we know, is also critically important. Exploring evidence-based practices, practice-based evidence, and innovative partnerships to eliminate health disparities across a variety of chronic and acute conditions like cardiovascular disease, cancer, hepatitis, AIDS, diabetes, overweight, and obesity is also critically important. And having an honest and informed dialogue about the impact of the Affordable Care Act, as we're going to do in these 2 days, on improving not only the accessibility, but the acceptability and the comprehensiveness of healthcare is also important. Lucky for all of us today, we'll be covering these topics, and we're going to be joined by some of our foremost experts like Dr. James Gavin, Ken Thorpe, Dr. Ken Thorpe, Dr. J. Nadine Gracia, among many, many others who are on the front lines of not only researching these issues, but launching efforts to address them and implementing various of the provisions of the Affordable Care Act. And of course, we have an exciting lunch planned where we'll not only be hearing about a multi-pronged effort to fight the diabetes epidemic, but also be honoring Dr. Bruce Siegel of the National Association of Public Hospitals with the 2013 Booker T. Washington Award for his forward-thinking and thoughtful leadership around health equity. Clearly, we have a very ambitious and busy day planned, as Gary always has planned for us. So I'd like to again just say welcome. Look forward to a very productive day as we engage in discussions about the current and rising healthcare, and minority health improvement issues that are of paramount importance to the communities that all of us are serving. So again, welcome, and thank you all for being here. And now I'd like to bring to the podium my partner and friend, Dr. Gary Puckrein.
Thank you so much. Good morning. I have been really blessed to have worked with Congresswoman Christensen for all these years in putting together this event. One of the things, and I always think about as I watch her, is one, incredible patience. I sit there and I get frustrated easily, and I just can't imagine how you live through Congress and town hall meetings and not get really frustrated about it. And so that patience that you have is really quite incredible. And it pays off. I mean, the Affordable Care Act and a lot of what's in there is the Congresswoman had a good deal to do with it. And a lot of people, 20 million minorities, are going to have health care, and they don't know her name. I mean, it's just the most amazing thing to me. So anyway, thank you so much. And Britt, who's always in the background there, but anyone who knows the Congresswoman knows that Britt Weinstock has had just really a tremendous influence on the legislation, as well as helping us put this event together. To my own staff, I want to thank them over and over again. They allow me to stand up here and look relaxed and calm, but in the background, they're making sure that things get done. And I want to thank you for coming. This year for us, we are moving into an action plan in two areas. And I'm going to talk to you privately. I'm going to say this to you collectively. We're targeting two areas. One is diabetes, and we're doing a lot with, I see some of the folks from ACC, the American College of Cardiology, and we're partnering with them, and ACE, the American endocrinologists, American Academy of Endocrinologists, clinical endocrinologists, I'm sorry. Diabetes is a huge problem. 50% of everyone with diabetes in the country goes to the emergency room or the hospital every year. That's the number. That's what's driving healthcare cost. We've got to fix that. One of the things that we're working on that I'm really proud about, everybody who knows us knows we map everything in the world we get our hands on. We're starting to move into what we call community-based continuous monitoring. And what I mean by that is we're putting together predictive models so that we can literally say, here's who's going to the hospital within 12 months who have diabetes, and if we want to break those patterns, here's what we have to do. And we're not doctors, so we don't provide care. What we do is we just count noses and really sort of try to give community the ammunition that they need. And so you'll see that, and we're going to talk a lot about that along the way. The other project that's dear to heart is the Clinical Trial Network. We're partnered with Microsoft, and I know some of the Microsoft folks are here. We're also working with Pharma and a number of the companies to get minorities into clinical trials. And don't tell me about Tuskegee. If we're not in clinical trials, we are not going to have the medicines and healthcare that we need. And this project is transformative because what we're going to do is link the minority community together in a research community that's constantly studying healthcare, a continuous learning environment. And I'm really excited and pleased about those two projects. And so we'll, down the road, during the course of next 2 days, talk to you a lot about that and talk to you individually about it. This is the best part of the program for me because some of the leading figures in American healthcare. So part of what you should understand is in this room are the people who drive healthcare, certainly in the minority community and certainly for the rest of the country as well. One of the people that I've had a great opportunity to work with when he was president of the National Medical Association and is now standing in for Dr. Bailey this morning has been Dr. Cedric Bright. He's been a friend and an ally, and we've worked closely together. The National Medical Association has been on the front line of looking at healthcare in the African American community. So I want to ask Dr. Bright if he'll come up and bring some greetings.
Good morning. Welcome. So glad to have you all here. And on behalf of my predecessor, actually my very good friend, Ron Bailey, who could not be here this morning, I stand in his stead as best I can to greet you this morning on behalf of the National Medical Association. To my esteemed colleagues who are gathered here, to Gary, thank you so much, and to the Health Braintrust, to Congresswoman Donna Christensen and the Congressional Black Caucus Foundation, Brent Weinstock, and to all the wonderful people behind the scenes that make this program go on year and year, where every year when I leave this place, I have a renewed spirit to go back and continue to wage the battles, to try to make a difference, not only one patient at a time, but populations at a time. With that being stated, healthcare to the National Medical Association is a right, along with liberty and justice and the pursuit of happiness. You cannot be happy and you cannot have pursuit if you do not have health. Health is something that we believe that you would want to keep. It is not something that we want you to lose. Think of it this way: we want you to stay healthy longer rather than get well soon. The landscape in healthcare is evolving. The Affordable Care Act has put into places many different constructs that will help, hopefully, to address the issues of health disparities. However, we're seeing some setbacks that I think are speaking loudly as to where we are as a nation in this crossroads. It's amazing to me the number of states that are rejecting Medicaid expansion. Medicaid takes care of our sickest, our poorest, our most infirmed. So what are we saying to them when we say, no, we will not expand this? What are we saying to their pursuit of happiness? I'm very concerned about that, and I hope that we will find ways in which to fight that battle together as a collective. The other aspect that I'm very excited about, and that's the aspect of clinical trials. I believe that that is an avenue in which, if we get involved, it's not just about subjects, but it's also about PIs. It's not about just private sector. It's also about the public sector. It's not about just universities, but it's also about NIH. Everybody, as I like to say, everybody has a stake in this. Why? Because the medicines that we give to our patients, we give with some type of evidence. And that evidence often comes in the form of a clinical trial. And if we do not have population representation that allows us to generalize to the patient that is in front of us, then we're in trouble. Because indeed, then the biggest clinical trial is the clinical trial when the medicine hits the market. And we've seen that already in drugs such as Ceravent. We've seen that with Avandia. We must have diversity not only in clinical trial subjects, but also in PIs to make sure that we have culturally relevant algorithms that break protocols that make it possible for people to participate and to do well. Understand that there are safeguards in place. The issues of the past remind us that we must have these safeguards in place to protect those who are willing to do something today that will only bear fruit in the future. It may not save them, as Jim Valvano may say, as the V Foundation, as Valvano put together, he said, it may not save my life, but if it improves the life of my wife or my children or their children's children, then indeed this sacrifice was very much worth it. We have an issue of manpower needs. As we move forward with the expansion in the states that have accepted it, we're going to need teamwork to pull us all together. And we all know the acronym TEAM stands for Together, Everyone Achieves Much. So therefore, we're calling on communities, we're calling on hospitals, we're calling on nurses, we're calling on doctors, we're calling on pharmacists, we're calling on social workers, OT, PT, you get it. Everybody has to be a part of this team in order for us to succeed. I want to thank you for your participation here today. Your presence says more than words can say, because there are things that you can give in life, and they're called time, talent, or your treasures. Many of you have already given your talent, and many of you paid registration, so you gave us your treasure. But your time means more because you are present in this fight. And that's what we need everyone to do, to be accountable, to be ready, and let's go get at them. Thank you so much, and enjoy the conference.
We've had the great fortune for a number of years to have the American Medical Association as a partner in this meeting and with other projects that we've worked on. So it's with a great pleasure that I introduce the President of the American Medical Association, Dr. Jeremy Lazarus.
Good morning, everyone. Great to be with you all, and it's especially great to be with so many colleagues that I've worked with over many, many years on these issues. I am very privileged to represent the American Medical Association on behalf of the nation's physicians and medical students, and I'm pleased to be alongside Congresswoman Christensen, Dr. Bright of the NMA, Dr. Akinboboye, who's done so much work on this conference, and of course Gary of the NMQF. Something I have focused on in my year as AMA president has been to deepen relationships with the NMQF, the National Medical Association, the Commission to End Health Care Disparities, and many others who work on how to eliminate inequality of care in this country. And it is why the AMA supports insurance coverage for all Americans. And it's why we supported the Affordable Care Act, an incredibly important, if imperfect, step forward towards health equality. These provisions were motivated by a clear and present danger to public health. You're obviously familiar with the statistics and the scenarios about how African Americans and Hispanics have higher rates of disease and less access to doctors. Now, the numbers themselves are infuriating enough, so too is that they become so predictable and so stubborn. You may have noticed a movie now in the theaters, 42. It's a story about Jackie Robinson, who integrated Major League Baseball in 1947 with what then was the Brooklyn Dodgers. Under extremely difficult circumstances, Jackie Robinson kept his cool, acted with dignity, endured the slights and abuse, went to 6 All-Star games, and 6 World Series, and was the first African-American athlete to be named Most Valuable Player. He's now in the Hall of Fame, and his number was retired by Major League Baseball. Jackie Robinson forever changed an American institution and American society and became part of American mythology. Yet this gifted athlete with an iron will died in 1972 of a heart ailment triggered by diabetes, which already cost him his eyesight. He was only 53 years old. Now, as the largest physician group in the United States, the AMA takes its position at the center of healthcare reform very seriously. And part of that work is to repair this system in which ethnic, racial, and gender minority groups face disparities in care and who suffer more frequently from serious conditions such as diabetes, heart disease, and certain forms of cancer. The AMA recently announced a new strategic focus to help physicians adapt, advance, and succeed as the healthcare system, as you've already heard, changes around us very, very rapidly. These are changes wrought by the Affordable Care Act, the relentless march of technology, and the new realities and needs of 21st century medicine and 21st century patients. This new 5-year strategic plan is a comprehensive effort to create a better future for America's physicians, medical students, and patients in this country. It has 3 overarching goals: to shape new delivery and payment models, speed the pace of change in medical education, and improve health outcomes for patients. Now, this last element bears directly on this conference and what it is striving to achieve. Our strategic goals include a major push to improve health outcomes in cases involving type 2 diabetes and cardiovascular disease, and this through better prevention and new team approaches to care. The AMA's efforts will include working closely with ongoing national programs, galvanizing America's physicians and patients to focus on preventing and controlling cardiovascular disease and diabetes, and teaming with new partners to address high blood pressure and prediabetes. This will improve efforts to treat these diseases and, if possible, keep them from happening in the first place. And it recognizes and pushes back on the persistent problem of disparities in this country's healthcare system. For the AMA and the patients that we treat, this is an important development, and I'm going to be speaking more about that in my session this afternoon at 2:30. It's a recognition that we need to look beyond the unimaginative solutions of the past and find new approaches to care that consider a patient's cultural context. And along with the people on this podium and with all of you in this room who have taken the time to attend this incredibly important conference, the AMA will work to make this happen, to see that everyone, regardless of race, class, or region, gets the best care available. Thank you very much.
I just want to quickly point out that in your packets are bios for the panel. For the interest of time, I was not going to read their bios, but they're obviously quite accomplished, and so you can see it. And I want to introduce you to the president of the Association of Black Cardiologists. We've had great opportunity to work with the association in a number of projects, and they're going to be doing something very special Monday night. So let me introduce Dr. Akinboboye.
Good morning. Let me start by echoing the remarks of the previous speakers by thanking you all for taking the time to join the National Minority Equality Forum and the Congressional Black Caucus Health Braintrust on their milestone 10th anniversary conference. Before I proceed, let me just take a quick moment to acknowledge the lives that we lost, those who were injured and those who were affected by the horrific events in Boston and West Texas last week. They shall remain in our thoughts and prayers. The Association of Black Cardiologists is indeed quite pleased to be associated with this great initiative, which is really focused on looking at issues of health equity from the standpoints of cardiovascular disease, infectious disease, oncology, and many other lenses. We know that there are populations that are disproportionately affected by these conditions, including the poor, the poorly educated, those with language barriers, racial and ethnic minorities. And we know that over the next 2 days, you're going to have the opportunity to listen to experts who will share with you cutting-edge information in these areas. They'll be talking to you about efforts and advances in this area, both from grassroots to treetop. And I'm talking about grassroots efforts. Let me just take this moment to quickly do a quick plug for the video of the ABC. I would like to invite everybody here to please join us back this evening at 6:30 here at the Ritz-Carlton for the viewing of an educational video by the Association of Black Cardiologists named Before You Eat Church Food, Watch This Video. This video was developed by the ABC in collaboration with some churches and other stakeholders. And the real focus of the video is to look at the role of the church in terms of modifying eating habits in African American homes. We do know that the great advances that we made over the past 2 or 3 decades in cardiology did not come from the angioplasties and the bypass surgeries and the TAVRs. They came mainly from our realization that we can actually mitigate this epidemic of cardiovascular disease by paying more attention to controlling risk factors, getting people to exercise, and eating right. And although we know that people on the average spend 1 day a week in church, but the influence of the church carries on for the remaining 6 days. So the objective of this video is to look at the role of the church in terms of modifying how people eat at home. And for more information about the video, I would like to invite you to visit our website at www.abcardio.org. So in closing, I would like to wrap up with a slight twist to a popular quotation by the great Madiba, Nelson Mandela, that health disparities are not natural. They are, for the most part, man-made, and they can be corrected by the actions of human beings. With that, I say thank you and welcome.
I want to thank our distinguished panel and Dr. Christensen. And I'm going to move us on to our sessions now and have a great day. And I'm going to be talking to you individually about some of the efforts that are afoot. Thank you so much.